The September 25th issue of JACC contains a communication from our surgical colleagues that deals with proximal aortic replacement, a procedure that's traditionally been associated with higher surgical risk. Most of the data, however, came from smaller studies, so these investigators probed the SDS database and were able to get data on 45,000 patients undergoing proximal aortic procedures of one type or another. And what they found were that if the surgical procedure were elective, the mortality actually was reasonably low, 3.4%. Still a significantly risky procedure, but pretty encouraging data. However, if the procedure was non-elective, then the mortality went up to over 15%. Needless to say, it's no surprise most of the non-elective patients had aortic dissections, and this is a sicker, riskier group. Nevertheless, when one looks at these data and sees the dramatic difference between elective and non-elective proximal aortic surgery, it really raises the question as to whether or not we should be operating earlier in patients with these types of disorders. This, of course, remains to be tested prospectively in a trial, but I think gives all of us pause for concern in terms of deciding the appropriate time for surgery in these patients. Pulmonary hypertension remains a difficult problem for clinicians, but recently we've had a lot of new interventions and medications to treat patients with pulmonary hypertension. Now, most of these agents have been validated in terms of efficacy utilizing the 6-minute walk test. And in this issue of JACC, we have a paper that looks at the value of the change in the 6-minute walk test in predicting the reduction in clinical events that might be produced by any of these new agents. And this is a meta-analysis. It's 22 studies, 3,000 patients. And again, the 6-minute walk test, as it has in the past, turns out to be very prognostic for morbidity and mortality in these patients. However, and importantly, the change in the 6-minute walk test produced by any of these agents in fact was not predictive of clinical events. And here we're talking about hard clinical events such as mortality or composite of mortality and hospitalization. So interesting findings again showing that the results of clinical trials have to be interpreted carefully when applied to the types of efficacy that one might expect when employing these drugs in their patients, at least for pulmonary hypertension.